So welcome everyone to Real People, Real Talk, hosted by yours truly, Salo Ortiz, and Meridian Psychotherapy Services. So this is every other month conversation we have about topics that that bring up a lot of questions, I guess you can say, topics that people don't want to talk about. That's kind of how it started. For me, we've been doing this now, I think, a year or so, and want to discuss difficult areas. And so we've done everything from the mental health care system to opioid recovery and recovery overall, to what else have we done? Race and the impact of race on services, and now addressing the LGBTQIA plus community. I'm getting better and better at it every time I say it. So, I try to keep track. My panel tonight is some distinguished guests and some last minute guests, because, I had another gentleman that was going to stand in or sit in with us, and he got laryngitis and decided to get sick. So I'm going to hurt him later. But, but life happens. Life continues to happen. So I've got a few people with me. I've got a panel of three. I think it's three, and then myself facilitating. If you've not been with us for Real People, Real Talk, the premise is simple. It's a conversation. It's not an interview. It's not a pre-scripted question and answer. It's just a conversation. We are recording this because we will post this later in YouTube infamy, so you can pass it around to whoever. And we'll see where it goes. I'm nervous about this conversation because this is a off topic for me. And so I've got a lot to learn in this conversation, and hopefully many people do too. So we'll see what happens. So it's simple. There's going to be a lot of interruptions, a lot of back and forth, a lot of talking over. I'm sorry if you don't like that stuff, but my meds are wearing off, so you guys are just gonna have to deal with it. So, but let's just have some fun. But let's have an honest conversation, if we will. With me on my panel, I'm gonna start with Alex, and then kind of introduce yourself and tell the people who you are, why did I ask you to be here, and what you hope to gain from being on this panel tonight of discussion. I know we may not have a lot of followers we're watching right now, but I know we'll have questions later. For those who are tuning in, I'll be interrupting regularly to say what we're doing, and please put questions in the chat. I've got my assistant here monitoring the chat and monitoring questions, and we'll take questions as we go. We'll also save some time towards the end for questions. So let's just do it that way. So Alex, set it off. Tell us who you are, why you're here.
Okay, well, I'm Alex Wall, LCSW. You can't hear me? Can you hear me?
I can't hear you, Alex. Alex said you can hear him? Oh, maybe that's just my fault.
It might be a you thing.
That's just my fault. Go ahead,
my mic is working. Okay, so I'm Alex Wall. I'm an LCSW. Salo asked me to join this conversation because he and I talk about it all the time, and I always challenge him on a lot of things that he thinks and says, and we always have really good conversations. I also have a pretty significant portion of my population that identifies with the LGBTQIA plus community. A lot of friends and, that are, I won't say necessarily in the community, but also right outside or connected to the community. So.
Thank you for giving us your time, Alex. I appreciate it, and your expertise. Alex always gets nervous when I ask her to do stuff because you are now the subject matter expert. And she's like, what does that mean? I don't know. We're going to figure that out as we go tonight. So thank you, Alex. Alex, you brought with you who and why, and then you introduce yourself. So go for it.
Okay, so I brought with me Jenny. She's a friend of mine, and I brought her because she is the parent of her child identifies as non-binary, and I thought she could bring a really good perspective, just kind of being next to and helping to raise a part of that new generation that is identifying with that community. So Jenny, if you want to introduce yourself.
Hi, I'm Jenny.
What's up, Jenny?
Yes, and my oldest child does identify as non-binary. So hopefully maybe I'll learn something in this conversation. So I hope I do.
Wait, I thought you knew all of it since you were a parent of a child that identified within this population. I thought you were the subject matter expert on your age.
Well, and my child is also 15, so actually I know nothing.
Very true. Very true. Gotcha. Thank you, Jenny, for your time. And I pray that we all learn something as a result. So I added Carla last minute, and Carla is standing in the gap. I owe Carla, I think, dinner, a month's paid rent, and probably a car. I don't know. I owe her a lot because I called her about an hour and a half ago and said, yo, you got to help me out. So Carla, you're muted, but unmute and tell us who you are, why you're here, and why did I ask you?
Good evening, everyone. Or everyone is okay. During my addiction, I got married, and she didn't want to stop her addiction when I did. And that caused a lot of problems in our marriage. We didn't make it being together a year before we separated. So I think that's why Salo invited me in, because, you know, I've had a little bit of experience with the addiction part and the LBG, you know, that part of it as well. So that's my story.
No doubt. So Carla brings a lot of depth of experience from, you know, mental health, substance abuse, and also just kind of walking a life that is this sort of journey.
Yeah.
People are going to ask, like, what's the point of this conversation? A lot of people have been asking me, a lot of people have been pushing back. Why did I decide to do this topic? Why did I want to do this recorded? Why did I want to do this when I didn't have, you know, a clear-cut answer for myself on it? And that's exactly why. I think that when we address, you know, a subject matter like this, we can talk about it from a social aspect. We could talk about it personally, like Jenny and her family, or even my own kind of being old school, but we have to be able to have a conversation. And that's what the point of this is. So
somebody needs to start the conversations, because we don't have the conversations. We're not able to reach out to get those conversations. If we have anyone, it's someone in our family. You know what I mean?
No
I
doubt.
think it needs to be, since we've come this far in our community, because back in the 60s and 70s, you know, people were getting killed. But since we are now in this day and age, I feel like it should be more open of a discussion. I'm glad that you're doing this, Salo. Thank you so much, because there is problems in this community. Yeah. And a lot of it has to do with mental health and addiction, period.
No doubt. So look, let me ask this. Let me start off with this. As you guys have, as guests come on, I'll interrupt regularly, so sorry, but ask your questions, type them in the chat, or just jump in, you know, unmute yourself and jump in. Let's just have it as a family conversation. But when us four, at least, are going to start off this conversation. One of the first things I wrestled with was, even in the typical sort of introduction, I've done a few of these videos. I've been doing this for a while. I've never had to ask for somebody's introduction to include pronouns, to include identification, to, like, I never introduced myself as Salo Ortiz, a Hispanic, fine young man, right, who is also Black and likes to take long walks on the beach. Like, I never had to do that. Why do I have to ask about your pronouns and your whatever? Like, is that being insensitive from the jump, or what? What do you ladies think?
So I know that a lot of what I've heard from my clients is just introducing yourself with pronouns instead of necessarily asking for pronouns. So like when you introduce yourself, you know, hi, I'm Alex, I use she, her pronouns. That opens up the conversation, or at least leaves the space for them to say, hi, I'm Sam and I use he, him pronouns. So, because I think there's also a lot of discussion about whether or not you should ask about pronouns.
That's true. So Jenny, when you had to kind of walk through this with your 15-year-old, right? And I'm familiar with this, because like I never asked, I didn't grow up having to ask kids your pronouns or whatever, but like obviously there's a conversation, there's a language shift. What's the shift like for you? Was it a shift for you, Jenny? Like, what do you think?
Very much so. So my child is female, and they came out to me when they were 12 as a lesbian. And it was within the last 6 months or so that they decided to start using they, them pronouns. And my child and their sister, you see, I still have,
no doubt,
been very good about saying they, them, sibling, and just very gently reminding me. But my oldest child has gotten very upset because I can't sometimes remember. So my child and I have actually had a couple of really good conversations that me not using those pronouns does not mean I'm negating what they feel, but they were born my daughter. So 15 years of them being my daughter is a very hard habit to break. But I am trying. And again, me not using those does not negate that I'm what they are feeling.
Right, right. So that's true. So look, here's the conversation I've had a lot with teenagers, with people in general. You know, it took me 44 years to build this blockhead, this hard head of mine and belief system. And so we need to allow a space for learning, unlearning, and relearning. And so because some of us are a little bit slower on the uptake, IEP track, right? Special, right? You got to give space for us to learn, but just because we slip or we mess up or we're struggling with learning a certain aspect of something does not mean that we're trying to be intentionally insensitive or unwilling to learn. And so that's difficult. So Carla, look, you navigate this, Carla, when people are not choosing to use, let's say, a proper pronoun or say, look, I'm not trying to learn that right now. Why do we give them the allowance of that space to not learn right now or not, right? Like, how does that work having to walk this life, Carla?
Honestly, maybe it's because of my age. I really wasn't aware of this until I start seeing things on TikTok. You know, I really didn't know what they were talking about. I had to ask my eldest daughter, what are they talking about? What does the pronoun mean? So I'm learning this myself. I think I personally would be uncomfortable asking someone their pronoun because I'm just not that type of person to just walk up to a stranger. But I do have a pretty clear advantage sometimes to be able to like read people, whether what they're wearing, their body language, how they talk. So I probably won't be that person to ask about pronouns. I'm not that person.
That's fair. And look, let me be real clear too to say, and I had to do this a couple months ago when we were addressing race. This is not making, while you may be subject matter experts in your own right, you are not the spokesperson for an entire population. Let me be very clear. I'm not the spokesman for all good looking, bald-headed Black dudes, right? Yeah, I'm going to keep saying that. I know, just get used to it. But you can't expect me to be. I can't expect Jenny to be the spokesperson for all moms. You know, Alex to be the spokesperson for all clinicians, and Carla to be spokesperson for somebody walking through this journey. But we are one perspective of that. And so I want to make sure that we note that. We may have to say that ongoing. But I'm going to ask generalized question. It's not that I want an answer that covers everybody. I want your experience in this. My experience has been difficult managing pronouns. And so some of that, when we're talking about treatment, it starts from the introduction, and it starts from the the initial sort of, hey, what's up? And that may dictate the rest of how mental health and substance abuse engagement goes, right? And so is it fair to say that it's like, I don't want service if you can't even get my pronoun right? Like, what do we do with that as service providers? Alex, what do we do with that?
So first of all, thank you for saying that, like, I'm not the spokesperson for all clinicians that work with this community, because I am not by any means. But I think you have a good point. Like, what do you do when you're presented with somebody who has, is maybe femme or masc presenting, but uses other pronouns or they, them pronouns? That's something I think for the individual clinician, they're going to have to gauge what is their comfort level with that. Are they able to adjust and roll with the punches? And then also, is the client able to adjust and roll with the punches? Like, being open and honest and clear. I think it's also important, like, what is the client seeking services for? Like, are they seeking services for that piece that is, is it the body dysmorphia? Is it the gender dysphoria? Like, what piece are they seeking services for? Because the reality is, like, I have a client on my caseload now. They are AFAB, assigned female at birth.
Gotcha.
Assigned female at birth. And they have transitioned to male, so they identify as him. So for me, when he did his paperwork, he put his gender as female, but he put his pronouns as he, him, And so I just went with he, him, and that wasn't a question. Like, I didn't even address that because that wasn't a part of what he was coming to see me for. And some of his feedback was like, you're the only clinician that asked me why I was coming to see you and didn't immediately address my gender. So I think that's one of the biggest things, is just looking at what's the presenting issue. Now, if the presenting issue is the gender or, the pronouns, then absolutely address that. But if it's not, I don't think that needs to be addressed.
So we shouldn't assume automatically for some folks, we assume that sexual orientation or gender identity and all those are the predominant issue regardless. You may be coming for your anxiety, you may be seeking services for your depression, for your substance use issues, but we automatically assume that it's also related to your identification. And that's not fair, because we don't do that for females that are identified, or however you said, Alex, as female, or, race and blacks, or people who are shorter than 5 foot tall, right? Like, we don't do that for any other population. Why would we do that for this population?
Right, exactly.
Yeah, that's a good point. And that's why we're doing this conversation. How much of an impact does this area have on receiving services? I mean, from Jenny, from your perspective, or Carla, from yours, how much of an impact does gender and sexual orientation have on the ability to seek out services or engage in services that you've experienced or seen?
Well, personally, I feel like it depends on how much support whomever we're talking about has. If this person doesn't have the support from family members, then they 9 times out of 10 won't get to that other side of getting help. There's been so many suicides because the parents just could not understand what their child was going through. And I'm so proud of Jenny because she's trying, you know what I mean? She's not turning her back on her child. And that's the number one reason I feel like the conversations aren't being brought up, because older but goody parents, like my parents were, it's an abomination, it's this, it's that. They get disowned, they get homeless. I mean, the list goes on. So to get to where we are right now, to even get them in to get the help, that's going to be the number one problem for me.
Yeah,
I agree. I will pat my own self on the back here just for a minute, but I knew my child was, I knew she was, they were gay, first grade. And I let them come to me when they were ready. No problem. I've always been very open in conversations with both my children. Their father and I are divorced, and he is the complete opposite. He is very religious. His new girlfriend, I mean, they're the complete opposite. So my house is a safe space. You get to be you, you get to feel whatever you want, you get to talk to me, we get to do things like that. So I know that in the community, Carla, I hear what you're saying because I've seen it in other places that they don't have safe spaces. So I love my children. I don't care if you identify as a purple potato. You are my child. And
yo, how'd you know my client? You heard my client? Like,
all right. But I want my children to be comfortable with who they are.
Right.
Life is going to suck sometimes. It just is. But you're going to have a safe space here, and we can talk about whatever. So
and the goal of therapy, the goal of a treatment setting, Meridian, Alex's practice, wherever you go, is to be able to also provide a safe space. Now, here you raise a couple things, Jenny. I'm gonna poke on purpose. So, yell at me later. But I'm gonna poke on purpose because we can provide a safe space even if we don't agree. This is not my forte. This is not my subject matter expert stuff. Like, I'm deeply, spiritual, deeply, traditional, deeply all that, and yet can still provide a safe space. So do you have to see exactly eye to eye in order to provide a safe space? And all three of you can answer this, because what I heard from you, Jenny, is like her dad, their dad is, has a certain belief system, but then they don't feel safe. But I don't have to believe like you just to provide a safe space. How do we do that?
So we've actually talked about that as well, because I've raised my children that you will have different opinions. And in a weird way, I'm glad it's their father who is their first test subject, because I don't know if I can exactly explain it, but I tell my children they have to be respectful that there are differences of opinions.
Right.
And if the conversation while they're with their father is too hurtful, to just, if they don't agree with it to that extent, they get to excuse themselves. But they have to know there are a bazillion different opinions, and you have to respect that there are different opinions.
Right.
So,
question.
Yeah, Carla.
How does that make your daughter feel that her father does not support that?
Fair question.
not good. It ties in with a lot of other stuff.
Okay.
Both my children feel that their dad does not put them first for anything. My oldest gets told all the time, you just haven't found the right boy. Oh, this is just a phase. On and on and on, to the point where now my child is uncomfortable, does not want to go see their father at all. And
I'll say, I'm going to cut you off just for a second, Jenny, only because here's the thing. How do we feel? And you're right. And it does tie into so many other things. And yet there's, how do we find, so part of the navigation, part of the journey that I've been on is to be able to still provide support for you as a child, or for you as an individual, even if I don't support this part of it. Because let's be real, like, again, Jenny, you said it, we raise teenagers, we got teenagers, and I don't support a lot of what you do. I think you're an idiot in a lot of ways. So I'm allowed to tell you you're an idiot, but I still support you as my child.
yes.
So they don't have to see eye to eye on this one in order to get full support, correct?
No.
Or no?
No, correct. There's a lot of issues. I mean, my child's orientation had nothing to do with our divorce. That's a whole nother counseling session, trust me. But it's not even that it's a difference of opinion. It is, he does not support our child at all.
Right. Which is a whole bigger issue than just this.
Right.
So that's where it peels back hard layers of the onion.
Yes. But I have an amazing support system here. I have family, I have friends. My child has friends. So there is a support system there in place.
Right.
Does she seek therapy? Is she in therapy?
No, not yet. I'm not saying that they will be.
Okay.
Right now, they are very comfortable in their own skin. Okay. Honestly, as comfortable as a 15-year-old can be, because being 15 just sucks no matter what. Right,
exactly.
Right. But I think that they are very comfortable in their own skin.
Yeah. Let me ask you guys this. And I feel this is another poking question, Jenny, you, but all of us in general, right? If you could look at it, Alex, as a therapist, Carla as a member of, but not, and you already kind of touched on this, Carla, from a pronoun standpoint. It almost feels like you are forced to have to accept this, or you're forced to have to accept kind of from the pronoun to the orientation to the language to the discussion or conversation or whatever, because I'm associated with, right? And so me as a therapist, I have to accept using neutral pronouns or accepting a certain lifestyle because I'm a therapist and I'm supposed to accept that. And I came to you, so now you have to take this. Or Jenny may have to accept this because she's a mom. Carla may have to accept this because she identifies as one of the letters that is this population. We're almost forced to have to accept this, right?
Question, Salo, what if one of your daughters came to you and said she identifies as a boy?
What if that happened? What if that didn't? I mean, that's true. Because the thing about us as therapists, Alex will talk to you about this. Therapists are going to hit you from a lot of different angles of levels of self-disclosure. We're all on a journey on this, right? It's not just a big picture, sort of what we call in therapy, macro sort of level journey, but this is intimate and personal too. The truth is that we don't know the journey that I've been on, or Alex or any other therapist or provider has been on in their own personal experience in life. So you're right. It could have already happened. We don't know. And that's why maybe some of the challenges exist. Either way, it's the necessity for us to provide a safe space and say, I do accept being a part of this, not because you forced me to, but because I choose to be a support, or I choose to be a part of this journey as well, right? Like, part of the acceptance of a population is accepting that we exist. The other part is accepting that it's going to take me time to transition or not, and that I want to, that I choose to take a certain, I don't want to say opinion, a certain place in this journey, right? Whether you identify or not, that's yours. That's intimate and that's personal. But do I have to be forced to accept things?
But you didn't answer my question, though.
What if they do?
What if one of your daughters does?
Yeah, for me personally, that's difficult, right? Like Jenny said, you're born one way. I see you as one way, but now I'm forced to have to accept everything else that comes with this.
You're forced?
So, and
I'm dad, because I'm dad. Yeah.
So I think the one thing that's really important is the differentiation between being forced and choosing to accept that person as a person, right? Because you are never, ever going to be forced to accept somebody as they are. And that's one of the things that this community is consistently hit with. Like, they're like, people consistently say, no, that's not a real thing. No, that's just a phase, or you just haven't met the right boy yet, or whatever it is that they're going to say. They're going to be continuously denied. So nobody on any level is being forced to accept this, but coming at it from a place of, you are a human being and you get to choose how you feel, how you present, and what you want to be. That's the bottom line. And respecting those people's choices as their choices. You don't have to agree with them, but respect is the bottom line.
Respect is very well said, Alex. Look, Carla's in church. Well, because here's the thing. I use truth across a number of different platforms, right? We could say this about gender and sexual orientation. We could say this about recovery. We could say this about interracial marriage and dating. We could say this about, the career path I chose. Sometimes, like I said, words like forced is, this is what I am, this is what I have, deal with it. Figure out how you wrap your head around it. And we say this again about, who we choose to marry or date, what we choose to do for a career path or not. Forced is sometimes the feeling that people that are in the support sort of role feel, because you're like, man, I have to accept you in recovery, or I have to accept you in an interracial relationship, or I have to accept you as, a housekeeper versus a doctor. I don't know, whatever.
So as a clinician, this is where I push back with my clients, right? Like, you don't have to do anything but die and pay taxes. So why do you feel...
Some of us got to be Black too. I mean, we are. I'm just saying. But yeah, go ahead.
But why do you feel like you have to accept that in the support role? Like, where is that coming from? And what's supporting that?
Yeah, I mean, because some of the force and some of that language says, biologically, we're wired together, right? We share blood in some sort of way, or we share a certain thing. And I'm forced to choose, isn't that funny, if from a language standpoint, that if I'm going to stay in a relationship with you, with whatever way that I'm in a relationship with you, then I have to take everything that comes with it.
So I really think it's interesting that you bring up the biology of it, right? Because, you have tasked me with a sensitivity training for kind of this same topic. And in doing my research, I found this amazing graphic, and I would love to share it with you guys. But it's basically an entire spectrum. Like, on one end is complete female, and on the other end is complete male. And then they have like several different layers of different things that influence what, makes you a male or a female, and all the different ways that you can genuinely be non-binary or intersex. It blew my mind. I was like, wow, this is incredible, because you got to look at hormones, you have to look at external genitalia, you have to look at internal genitalia, you have to look at chromosomes, so you're looking at all of these different factors. So the reality is, you're saying truth is truth, right? But the reality is, you don't know what that person's truth is. So their biology could reflect the truth they're presenting to you, but you have no way of knowing that.
Wow. She said, wow. So, all right. So look, she said, go girl. Here's where I'm gonna push it back to from the clinical standpoint. Is it my responsibility as a clinician, or is it your responsibility as a service recipient to educate your clinician, or from us as the service providers, Alex and me, to have already an awareness or an understanding of that? Because I'll tell you what, you blew my mind. I got a headache. I don't get it. And maybe I don't want to get it or not. But you see what I'm saying? Whose responsibility is it to be able to learn and understand that? The person seeking the treatment or the service provider?
So I think the reality is our ethics tell us it's our responsibility that if we're going to be serving this population, we need to know what we're talking about. We need to know what we're doing and how to appropriately and culturally treat this community.
Or to be able to say, I have no freaking idea, and this is not my area of expertise, and I'm not going to work outside of my scope. So recognize we can talk about some things, but I can't go there because I don't get it. And I think that that's fair to say as well.
Absolutely.
Because the task of service provider to say, you need to educate yourself and you need to kind of get up on this. Maybe I have no space left in my hard drive. You know what I mean? Like I can't, maybe I can't. Is that okay for us to say? And is that okay for you as recipients? Let's say Carla, Jenny, for your child to say, yo, you can't handle this, but I still want you to provide services of some sort of way. Like, how do you do this?
I will, if I can jump in, I will say, because I have been in therapy on and off since I was 19. And I've had some therapists that just, it didn't fit for us. And I didn't have anything quite as big as the LGBTQIA plus community. I didn't have an issue that dealt with something like that. So I had no problem telling a therapist, hey, I'm sorry, this isn't going to work. And depending on how they responded, I just either left it at that, or I would say, we don't fit because. So I've never had anybody tell me that as a clinician. But if I'm going to put myself out there, I would want a clinician to be like, hey, this is something A, I don't know about, or B, I do know about, and I'm not comfortable with.
Right.
Maybe I'm, being too optimistic, but I would prefer that somebody tell me, no, I'm sorry, this is not my wheelhouse. I don't know enough about it. It's not my strength. It's not something I want to deal with.
Absolutely. And I will say, Jenny, thank you for that. And I hope that people hear this later on or really refer back to this. We have the right to be able to say, yo, like you said, this is not my wheelhouse, nor do I want to make it my wheelhouse.
Right.
Because this is the same as working with 6-year-olds or, or 76-year-olds. It's not my wheelhouse and I can't handle that. So I choose not to. And you have the right to say that. We as service providers have the right to say that, and we should feel empowered to say that. And we should also be ready to say, let me send you to somebody whose wheelhouse this is.
Yes.
All right. And so for everybody that I get that comes to me because they love me, I'm gonna say, nah, go talk to my girl Alex because this ain't me.
Right.
Fair.
So, but wait a minute. If you have someone who is trying to reach out for help that doesn't have the support, and you're the first one that they talk to, and then you turn them onto someone else, there's a chance that they won't even get the help at that point. Absolutely. Because you're not opening your mind and your heart to even try. Even if you don't understand, if you just listen to what they're saying, you'll get an idea of what they're going through. But for you just to disqualify them and throw them to somebody else, come on, man.
Carla, how does that work? Because Carla, look, let's talk recovery, for instance.
Okay.
Let's talk recovery and say, this is the this is the issue, and I'm seeking help, let's say, from a recovery standpoint, an addiction and recovery standpoint, but this is also not your strength, and these are coexisting. In mental health and in substance abuse, we find what's called co-occurring issues and situations, right? They're both occurring at the same time, and they're both issues. So I'm strong in one, but not the other. Everybody knows that they work with me. I'm really strong with substance use, but I'm not strong in this area. And
but
so
see,
what do we do?
What I don't understand is, you've never had an addiction in your life, but you're there on top of that part of it. Right. And you haven't had anyone, I don't know, in your family who is gay or bisexual or whatever, to have that experience. I feel like anybody in the medical field, whether you're a therapist or whatever you are, they need to be educated, because this part of us and this world is growing so much that it's not enough help out there. You know what I mean? We need people that will invest to get to know what to do, or invest what to say to us, because It's the people, not trying to be funny like you, Salo, who's just ready to push that person aside,
Right.
that makes us say, F them. They don't care about me.
Absolutely.
Why
and you say
should I
the
go
same
get
about
help?
any subject, right? Here's the truth. And here's what I think, and maybe this is just my opinion, there's got to be a desire to want to grow and learn. Because Carla, you're absolutely right. I'm glad you went there. I'm not an addict. I'm not in recovery. And yet I have a heart and a passion for it. And so the individual that's providing the services and help has to have a desire and a willingness to grow in a heart and a desire and a passion for, or be able to say, like Jenny said, I don't have a desire. I don't have that weight on my heart to have to grow in this area. But there's a conversation that needs to happen.
Okay, let me ask you this. Are you seeing anybody out of your patients who is gay or bisexual?
I am.
Total how many?
Whew, wow. Currently, let me see.
Yes.
Yeah, I could even say in my current case or in my history of caseload, handful, 5, 6, I would say. But let me say, hold on. Let me say, one of the challenges, one of the responsibilities we have as service providers is to identify who we work with and what we're able to work with comfortably. And they know based on Carla knows she's worked with me based on my, not just hard-headedness, but my opinionness and my approach to certain things. They know that they can't refer or can't stay for this issue, but they can stay for this. So to be fair, my caseload has never involved this because I've never sought it out. And like you guys had said earlier, this was never an issue or a topic, right? Like Alex had said about her client, this was never an issue that I had to pursue. We were addressing other things, you know what I'm saying? So this was never something that had come to the forefront.
So what made you want to do this one tonight? Why did you want to do this?
Yo, my homeboy asked me this back home in New York, and they were like, yo, what are you doing? What made me want to have this conversation is exactly the discomfort that I'm feeling right now and that many people have. Yo, I have no clue what I'm talking about. And I could either try to figure it out and get learned and educated on the quiet tip, or I could do this publicly to kind of walk this journey and say, yo, I have no idea what I'm talking about. And I don't know that I even want to learn more, but I know that this conversation needs to be had because some people may or may not want to have more. But I know that it was also, right, my homeboy brought up to me earlier, he said 25% of, I don't know, what are we on? Generation Z, whatever
Z.
generation young people are, right? 25% of that population versus us Gen Xers, which is the real generation, right? Y'all better recognize, right? But it was like 5%, I don't know, some single number population, right? That was never an issue for us or even our fathers and forefathers, right? But now we have to educate. Yeah, Alex, go ahead.
So that's kind of one of the things I was going to say, right? Is like the percentage of the population that identifies as the LGBTQIA plus community is significantly exponentially growing, right? Now, the numbers that I found for 2020 was Gen Z, 15.9% of Gen Z identify as a part of that community. But even as you're saying, Generation X, if you go back in the years, Generation X had like 1.5%, maybe back in like the 90s. But if you look at 2020's data, they're up to like 2.53%. So even some of that generation is starting to recognize and kind of do some self-reflection and say, you know what, maybe I'm not as straight as I thought I was, or maybe I'm not as straight as society is telling me I am, and so, and I think you're making a really good point though, like, yes, it is up to the clinician to say, hey, this is my scope. And I think it's also up to the clinician to say, recognize that this portion of the population is growing exponentially. And so I am doing a disservice not only to myself, but to the population that needs my services to not be educated about this.
Right. Absolutely. So pause real quick, just to kind of give everybody an idea. Look, if you're tuning in late, if you see this later on, this is Real People, Real Talk with Meridian. We're talking mental health and substance use services within a LGBTQIA plus community. We welcome questions. We welcome feedback. It's been a heavy topic because it's so hard to navigate this subject area and not make it personal. It's so hard to navigate this and not be so intimate with it. Yet when Carla talks about me, let's say, doing substance use services, it's personal because I love this with a passion, but it's not it's not intimate per se, but it is, right? Like we find a way to be able to kind of push off certain issues like anxiety, depression, addiction. But this one is deeply personal, right? In so many ways. How do we make it not so personal? Or is there even a way to make this topic not so intimately personal, even as the population grows?
I struggle.
Oh, I'm sorry. Go ahead. Go ahead.
I was just going to say, I really struggle to see any way, if you're looking from a clinical perspective, you are seeing like the dirtiest, most shameful, intimate piece of people's lives. And to be involved with that and to try to make it impersonal, I think is the wrong direction to go. Now, do I think that we should maybe take a page out of DBT and use our wise mind? A little bit of emotional mind, a little bit of logical mind, come together in the wise mind. Absolutely. Yeah.
Getting clinical. Love it. That's why you're the subject matter expert.
Oh yeah. Okay. But I mean, that's the reality, right?
Yep.
We cannot take the emotional piece out of this because
Right.
we're inherently emotional beings. And so I think that again is a disservice.
Right. Yeah, that's fair. Carla, what do you think? Jenny, what do you think? As you look at kind of navigating this from your perspectives, can you disconnect? Can you kind of draw some space, or is it always going to stay intimate and personal?
What I was about to say is gay people have been around forever, right? It's more open now, thanks to Caitlyn Jenner, thanks to the show Pose. There are a lot of other different things that people can watch and get an idea on what these young people, even Dwayne Wade's son, is so much information out there now than when it was 30 years ago, 30, 40 years ago. So I know that part is going to help this community because people are alert, people are aware, people are more accepting. But then you got this 1,000% over here of people who get sick to their stomach if they see two people kissing of the same sex or getting married, all these other different things that we finally have the right to do. When they legalized gay marriage in Virginia, it was the end of October of 2016. Me and my wife got married in November of 2016. We ran down there. So I think just open up the table and talking about it will get people who are not supporting it, people who are against it. I think if they hear it more from individuals who are struggling to get up in the morning, to even put makeup on or go to work, if they're able to see that person's life and how it goes from 0 to 1,000 going down, because that's what happened with me and my wife. Our addictions ruined our marriage. It wasn't that we didn't love each other. But we didn't have the support. I didn't have the support from my mom. My oldest daughter is married to a woman as well. My youngest daughter has been with women. So it's something that I seen them go for first before I did. I always felt comfortable with a woman. My first kiss, I was in 3rd grade, was with a girl. So I knew something was there. I just didn't have enough information to see that whether this is right or wrong. You know what I mean? Like I said, my mom kept me in church. So I couldn't, just let me say this. My first marriage to my ex-husband was because of my mom. I didn't love him. I didn't want to be with him.
Other people.
But because of my mom, I got married. I had 3 children. It wasn't until I finally woke up and said, I cannot live for my mother. I cannot live to make her happy or to be comfortable. I have to be able to get up and look myself in the mirror and say, this is who I am. I don't give a hell what you think.
Right.
But that took time. You know what I mean? It took a long time, a lot of depression, medications, addiction for me to get to that point.
It took learning. Yeah, absolutely.
Exactly.
Carla,
I really think.
Go ahead, Alex. Go ahead.
I was just going to say, I really love that you told that story, Carla, because it is, for me, it exemplifies the fact that, like, yes, your sexuality played a part in what was happening in your life, but the reality was that wasn't the driving part. The driving part was, you know, kind of the sorry, my train just crashed. Hold on, it's coming back. You know, that desire to you know, meet that expectation of your mother. You know, it wasn't really about the sexuality. And if you had sought therapy or clinical services from strictly that perspective of your sexuality, I think, again, you would have been done a disservice. So I think that's really awesome.
Absolutely.
Thank you for sharing that.
I know if I had have gotten help back when I needed it, I would have never got married to my ex-husband. I probably never would have had children. I would have been with a woman because that was where my comfort level is. Now today, because of everything I've gone through with this woman, I'm single and will remain that way. I don't know what I want, whether it's a man or woman.
Understood.
I just want to have a peace of mind, and I have that. You know what I mean? So
look, here's what I gleaned from this, and here's what a comment that came through via text. And so we welcome questions, we welcome comments. You know, whether you send them to me, right, on my phone, or you send them in the chat here. I got somebody monitoring that. There's a willingness to be open to the discomfort, which we've acknowledged, and we're grateful for that, right? So some people, even in my own family, say, "Yo, why are you having this conversation, Salo? What are you doing? Right? Are you submitting? Are you acquiescing to sort of the social movement that is? No, I want to have a conversation." And there's a need to be gentle in the language, is what was pointed out here. So thank you, Sophie, for pointing that out. And thank you for people. You recognize there's a need and a desire to acknowledge a population that is growing, and to not ignore completely. And there's a need to find gentleness and an appropriateness in the communication, the conversation, in the language, so that we can all learn. The purpose of this conversation tonight, the purpose of this ongoing, is to be able to find a way to find a new, not even a neutrality, or sort of a common ground in the language that we use, so that we can continue to have the conversation. Is that fair to say?
Yeah, absolutely. I think for me, the reality is, unfortunately, you know, a lot of the people that I've encountered who are not willing to kind of accept the humanity of people who identify with the LGBTQIA community is because they don't see them as people, they see them as labels. And so being able to humanize the people that identify as a part of this community is so important. And again, like Carla and Jenny, like, I just really appreciate you guys being willing to come on here and just show that human side, because I think that at the end of the day is what's going to bring people together, is just seeing people as people.
And that's what we faced with race. That's what we faced with culture. That's what we faced with addiction. To see a population or a group of people, regardless, as people, right? Not as 3/5 of a person, not as a one drop of a person, not as, right, but completely a person. And when Carla asked the personal question, what if this was in your own family? That was something that I had to face. We are still looking at people. We're still looking at my child, my family member, my loved one, but also my client, who I intimately pour into as an individual and as a person. And if we can do that, we can then have a common ground to then start building a relationship and a conversation, even if there's a disagreement. And that's what Jenny was saying with even her child and her child's father, right? Is that there needs to be an opportunity to see this individual as a person. Regardless of what your opinion is, there's a need to be seen as a person, right, Jenny?
Correct. I mean, I still struggle, and I've talked with my oldest child about this, that I am just old enough that sometimes I don't understand. I don't understand all the different labels. It sounds very, I really don't even like that word, but the labels, the pansexual, the asexual, I don't always understand them. Here's the thing. However anybody is living their truth, if it is not hurting me, if it is not hurting my family, if it is not hurting that person, it really doesn't make any difference to me, because everybody's got to live their own life. I am trying to understand it. I don't always understand it. I will ask questions. I do want to understand, but when I have this conversation with my oldest, I'm like, here's what I don't understand.
Right.
Here's why I don't understand it.
Right.
And I'm trying.
Right.
I'm trying.
So Jenny, I think that there needs to be a space to be able to say there needs to be a level of grace and forgiveness along the conversation and along the path. There also needs to be, and this is what I'm going to say, and Alex, you can back this up or not, or go against it, to say, from a clinical standpoint, there needs to be a limited amount of time and spent on being able to try to understand, right? We need to be able to engage and then disengage, engage and then disengage. You don't have to stay in the conversation until you get it. You don't have to stay in the conversation until you understand, because I may never, but you have to stay in conversation as long as you're able to, and then say disengage. And listen, let's be real. Okay, so if we don't understand that, boxers do this, UFC fighters do this, right? Therapists do this. You're not staying with me forever. There is no billing code for a 24-hour session. I wish there was, I'd be rich. You get 30 minutes, you get 45, or you get 60. Boxers get 5 minutes in the ring, or 3 minutes in the ring and 2 minutes off. There's an ability to be able to engage and then disengage, because we have to let it marinate. We have to let it sink in and process. So you don't have to stay in the fight until you get it. That's something that's almost a misconception when we're talking about this population. Is that fair?
I think that's totally fair. And I mean, it's the same concept. Even if you're in school, you're not going to sit there for 24 hours and study, because guess what? Your brain's not going to comprehend it. You need to sleep and eat and, maybe disengage from it for a little while. And, your brain will be able to make those connections and process it a little bit better. I think the biggest issue, and for me, is those people who engage and then there's like, oh, I don't get it, I'm done, and that's frustrating, because these people, the people that identify with this community, they are still out here and they're still facing the discrimination and the need to consistently advocate for their existence. And I don't think that's fair. And, to bring up, a little bit of a buzzword, but that's privilege.
That's fair to say, right? There's a lot of privilege along the way. There's a lot of hot topic. There's a lot of sort of trending, if you will, is another buzzword, just like privilege, right? We're not forced to. We have to engage in the conversation and have a willingness. We have to then engage in the conversation and understand the parameters and the rules of engagement. Both Jenny with her child, or even her child's father, us as therapists, and Carla as a person who is navigating this just for her own journey, her own experience with her children, or with her romantic individuals, and then with her service providers, to be able to say, yo, what are the rules as we engage in this? Because there's a willingness to engage. Let's explain and identify the parameters of how we do this, both with time, with energy, with purpose, with passion, with language, with sensitivity, with gentleness. But we have to stay focused on what the focus is. Correct?
Right.
Yep.
Right. Yeah. Again, like I said, I don't have to understand it, but I accept that my child, that anybody that I come in contact with that is part of this community, I have to accept that that's their truth. And I like to think that I do. I like to think that I'm not going to judge you because you identify as whatever. I again, be nice to me, be nice to my children.
Right. So Jenny, you raise a good point, right? For us as service providers, for people who are navigating this, in this being the truth that is their sort of journey of trying to understand orientation or gender, there's a need to have some grace and room for correction, and the need for the person, the individual that's on the other end of this conversation, or the other end of this relationship, to receive the gentle kind guidance and correction.
Yes.
Right. And this is true not only of gender and sexual orientation, right? Let me tell you, I had a family member, right, way back, talking about his experience. He was older 70s, maybe 80 something at the time, and was telling a story of his childhood and talking about niggers. And instantly, I could have chose to get mad, or I could have chose to appreciate the fact that this was his truth and this was his experience growing up. And he instantly caught himself, because he remembered who he was talking to. He's like, I didn't mean it like that. I understand that. But there's a gentleness in the correction and the guidance as we learn. Remember, the point of this is to learn and to grow. And so I could have gone right back at him and say, you racist bastard, blah, blah, blah. Or I could have said, no, I understand. I get where you're coming from. I'm still not cool with that word or the usage of, but that was his experience and his understanding, because he was older. Mm-hmm. This was all he knew growing up where he grew up.
Right.
I think alternatively, had he not been open to that gentle correction, you would have been completely justified and like,
Absolutely.
There's
There's a space in there where you receive the correction and the guidance, and your next step, and this is truth, Alex, of any mistake or any error that we make, both in playing a musical song or an instrument to the language we use to say, oop, my bad, just like Jenny did in using the use of pronouns to say, yo, you either take that guidance to correction or you say, nah, too bad, I'm gonna go with what I know. And Alex and I have done this many a times back and forth. As she corrects me with pronouns and binary or non-binding or whatever, she's like, no, it's this. Okay, Alex, whatever. My point is this. No, Salo, you need to stop and take this and understand this. And it's the step right after the mistake or the step right after the error that usually then forms a sort of the opinion of where this is going to go.
Right.
Right.
Thank God for you, Alex. Thank you for teaching me, girl.
Listen, I do what I can.
Yo, no doubt she does. Look, and some of us, so let me go to this question that came to me earlier, right? We welcome the questions, we welcome the conversation. Even after this live is over, we welcome it. This is what came. We got to understand, DSM-3 had homosexuality as a disorder until the 70s. 1970 something. I was born in 77. This was a disorder when I was born. This was not a disorder when some people were born or some of our children, Jenny's children, were born, right? And we could say yay or nay, but this was a real thing, right? Understanding then, here's a question that came, right? Understanding is somebody that identifies as a certain way or an opposite gender, right? And then understanding disorders and diagnoses like body dysmorphia, like gender dysphoria, right?
Yep.
These disorders that are current and on the books that Alex and I and people like us as professionals in this field have to work with, just like addiction and just like even issues like substance abuse versus substance use disorder, and learning to stay current with language as it continues to evolve. This is a difficult task for us as service providers, and understanding that we're working off of a manual, a diagnostic and statistical manual that is the said Bible of diagnosis, and it's forever changing. But we have issues, Alice, like gender dysmorphia. While we're talking about gender identity and gender neutrality, what do we do with this when we're diagnosing something like this, Alex? What do we do?
So I think to start with, understanding that the DSM is inherently flawed in so many ways, right? And the
yet that's how we get paid, Alex.
Right, and that's the reality, right? We have to look at that from, this is unfortunately a necessary evil, and it comes back to, what is that presenting issue? Is it the gender dysphoria? Or the body dysmorphia? Like, what is it that's presenting? How do we, or is it even not, is it even the gender, or is it the depression, from not having that support, from not having that community in place? Is it the anxiety that they will be, what's the word?
Judged.
Oh my gosh. Yes, judged. Thank you.
Good call, Carla.
What is the actual presenting issue, and really sometimes you have to take that buzzword out, taking that gender or taking the sexuality or taking whatever out. And is this actually completely a different presenting issue if you take that out?
Right.
Can I say something? Because
yes, please do.
And I do apologize. It's my eldest grandson's birthday and I'm about to go out to dinner with him. But something that bothers me is, out of all the 7 cities in Virginia, there's nothing for us. No type of recreation, therapy.
When you say us, what do you mean? What do you mean us? Which part?
As far as the LGBT, there's nothing in Virginia in 7 cities. So that is a problem. Nobody is going for us. Nobody is coming for us. Nobody is trying to help us. We're on our own. But if you go to California and San Francisco and all these other different parts of the world, they have all kind of communities to celebrate and help people. But not here.
So Carla, there was a conversation and a question, right? Not just for my loved one, but even for you, like you asked me, why are you having this conversation, Salo? Because I recognize that there's a gap, there's a need for, and while I'm not willing to maybe necessarily stand in the gap, I recognize that there is a missing part, right? So Carla, what would the takeaway be as somebody who's continuing to navigate this, not just for yourself personally in treatment, not just for yourself as a parent, but just yourself as a person? What would be the takeaway as you have this before you go? What would you want people to take away from this conversation?
I just wish people were more like Jenny.
Redhead, beautiful, with glasses? What are you trying to say?
For her to support and accept her child, no matter what she wants to do or not do, is something I wish this world could turn on. You know what I mean? And I know we've come a long way, but there are still people dying every day because they don't have it. They don't have that support. You know, her own father, you know, just think about that. Your own father doesn't want nothing to do with you because of who you are. Like, that's some fucked up shit. I'm sorry for cussing, but that is mental, that's for daddy's little girl. You know what I mean? I grew up without my dad, and I don't know how I would have reacted if my dad treated me different because of who I was. I couldn't even imagine going through something like that.
Right, who I was at the core.
My mom, but my dad, oh man, come on now.
Yeah. So Carla raises a good point. Carla, we respect that you got to go, and we welcome questions.
I'm sorry, and I love y'all, but I got to go celebrate the birthday.
Understand, go celebrate, tell them we said happy birthday. Thank you,
All
Carla.
right,
Listen, here's the takeaway, understanding support. And maybe, Alex, this is where we discuss this, knowing that, again, we are not the only people that have a say in this conversation, and Jenny, you as well. When we use words like support, when we use words like understanding and appreciation and respect, there's different levels and types of that, right? And so Carla asked the question of mine personally as I navigate this, and I have to decide this for myself. Having been in this field for over 20 years, having been born a man and appreciating his penis in full capacity for 44 years, right? There's still a level of support and understanding and appreciation and respect, but there's different types. And so there has to become an understanding of what support looks like, because it may not look like what the recipient wants it to be, because it also is the provider of the support that I can provide support in this way. Support for me, for instance, is, let's say you provide support because I want your financial support. It's not always money. It's not always time. It's not always understanding, but it's support in this way. So what kind of support do we expect in this population? And it's not just throwing money at it or time or energy or resources or what. What does support look like, Alex, as a service provider? What does support look like, Jenny, as somebody who's navigating this for a family member? What does support, respect, appreciation look like?
So from a clinical perspective, I can just tell you, you know, I already know I don't know everything. Like you were saying,
this told me you did.
This is a very dynamic community, and they are growing and changing. And, you know, it's important to respect that. You know, it's important to say, I don't know everything. And it's also important to recognize that what one person says and understands or uses a specific term for may mean something completely different than even the next person is. So it's creating that space and you taking that judgment out of the space, creating that space to have the discussion and taking the judgment out. Yeah. So I think that's what it is for me, and just being genuinely curious and asking the questions.
Mm-hmm.
Right. Jenny, there's an expectation, like Carla said before she left, and understanding your journey and your child's journey, that support says it's all or nothing. No, not necessarily. As a father, I'm a father, right? And I have daughters and I have children, and I also have clients, and I also have people that depend on me. Support doesn't always have to mean what you think support means. I can provide this support. Are you willing to accept that support or not? Is there a level of support that your child's father is willing to provide that your child is not willing to accept yet, but they only want it on their terms of, you can only support me if you support me in this way, or don't support me at all, right? That's sometimes the argument.
It is. And I see the question from Shay. I hope I said that name right. So quick little backstory. It took me a long time to get pregnant with my first child. So when she was born, you know, I was like, oh my gosh, this is it. And just through our journey, you know, now they are 15. They know I'm the dumbest person on the face of the earth sometimes.
Right.
I feel, I'm not gonna lie, when they came out to me at 12, I was like, let's buy rainbow everything. I'm gonna buy the mama bear. I mean, I am it. But I had known for 7 or 8 years that my child was in this journey. And do I possibly go a little bit above and beyond because their father doesn't? Again, yes, but I also do it for their sister too. And my daughter is straight. So I think I go above and beyond in support because of other issues with their father.
Right.
I don't know if that answered anybody's question.
It does, because we
Sorry.
say, again, support looks like, right, understanding that support doesn't mean having to fill a void that exists, and I'm the one that has to fill that void.
Right.
Right. Just like
Right.
support for my child, support for my client says, if I support my addicts, my clients that are in recovery, by saying I'm going to give you money, no, that doesn't mean I support you, because you're still an addict in recovery. I can support you in this way. You either choose to accept the way I'm able to support, or you say that I don't support you. And for clients in recovery, they'll say, well, then you don't support me. Just like clients who are navigating this difficult path that is gender identity and sexual orientation or not, you either support me or you're not. You're either with me or you're against me. That's not necessarily true.
Mm-hmm.
Right. And maybe that's the conversation that your child has to have with her father, and you need to also, or some of us have to have when we come to this topic, just like we do addiction or depression or schizophrenia.
Well, and I agree. I don't know. I don't think their father is ever going to change their mind, which is fine. I tell them that is his opinion.
Right.
But I like to think that I support both my children, because if my oldest was straight at 15, I would be having a discussion with her about boys. And because they are identifying as as non-binary right now, I'm discussing girls. It doesn't matter. I still don't know anything. And I'm still trying to navigate my 15-year-olds through life.
Right. And keeping them, listen, here, some of the conversation, because to Shay's credit with the question, some of the things that we recognize as forced or not when we use certain language and terms like that, and Alex, you can jump in with this, is this almost feeling like if I don't, quote unquote, support in the way that you want support, then I risk things like Carla brought up, like suicide, self-harm, or other sort of deeper traumatic issues. Mm-hmm. And there's a fear level that comes with this population and navigating this conversation, because you either are with me or against me, meaning you're pro or against, and there's life or death at stake here. Yeah. Right? Support means you don't support me, I might as well hurt myself or kill myself. No, I don't want that to be the full result. Do you teach me how I can support you? Am I willing to learn how to support, or does that always mean to? Because the costs of this are very great when we talk about life or death, when we talk about self-harm, when we talk about trauma. And that's some of the fears of some of us who didn't have to always have this conversation. Right? That's scary, right? Support doesn't always mean what you think support means. I have to learn how to support, and I have to learn that it doesn't mean that if I initially doesn't mean that it's going to result in life or death. And that's oftentimes the case in this population. That's why we're having this conversation, correct or not?
Yes. Yeah, I think it's really important, to just to even say that, like, this is a serious issue. And for specifically, young people who are discovering themselves and discovering their sexuality and their identity and their orientation and all these things, they do need support, and of course, support's not always going to look like what they want it to. And are you willing to come to the table? Are you willing to sit down and have that conversation? Because guess what? A lot of people are not. And I think, just my personal, not research-backed opinion, I think that if more people were willing to come to the table, I think that those statistics would change significantly. Again, bringing the humanity to the issue, because the reality is so many of the stories are, I was kicked out of my house. I was, told that I was going to hell, or, you know, whatever the story is. It's not just, I don't support you the way you want me to. It's, I am completely rejecting you. And so
there's a difference. There you go, Alex. There's a difference between support and flat out rejection. And oftentimes the assumption is with the population, specifically with this topic that we're talking about, just like we do race or culture, that you either are with me or against me. You're either support me or you reject me. And that is not synonymous. That is not always the same thing.
Correct.
Right. That's difficult. That is so difficult to navigate as a parent, as a clinician, as a provider, as a person, as an individual, right? It doesn't mean full-on rejection, but sometimes the recipient only receives it as rejection because there's almost an assumption that it is always going to mean rejection, and that's not necessarily true. And how do we show, okay, here's the takeaways for people who are watching this now or later, clinically, as a parent, Jenny, as an individual, for us as people, how do we show that support means this, but it doesn't always mean rejection? How do we get people to understand that full-on sort of resistance to this doesn't mean full rejection? How do we get people to understand that it doesn't mean always synonymously with rejection? How do we get people to understand that?
I think honestly, we have to be open to having conversations.
Right.
And we can have I can have a conversation here because we are adults. We don't all agree, but we're all adults and we know that we can have a conversation. Again, my child's 15.
Right.
I didn't want to talk to my mom when I was 15.
Right.
But we have to be able to know how hard, how much to push. And again, I don't even know if that's the correct term, but how to be like, hey, this is a really difficult conversation, but we really need to have it. You know, we need to bring this up. We need to bring it out of the shadows, out of the taboo, out of the, no, we're just not going to talk about it. No.
Right.
Be
so
uncomfortable.
Jenny, let's do a real life in person. We didn't rehearse this, Jenny. We never met before 6:30, you know, in our relationship. And yet we're in a relationship. Sorry, but we are. So now let's do a real life in-person sort of scenario. And I don't know which way this is going to go. Okay. Jenny, the conversation is for Salo Ortiz and Meridian Psychotherapy, or Salo Ortiz, the clinician, the LCSW, the greatest to ever do this clinical work. I just had to do that, right? Do you either, Salo, support or reject this, right? And so Jenny, is the takeaway for you, having never met me and having sat in this now for a little over an hour in this conversation, do you think that there's an understanding that I support, me personally, Salo Ortiz, do I support or do I reject this population? Jenny, what do you think? What's your takeaway, even just after an hour and 10 minutes?
So I do not think you reject it. I do not think that at all. I think you accept the very basics of it. I think you personally may want to know more about the community, about the issues that face the community. I think you want to know this because in the hour that I've been watching you, you do want to know. You want this information. What you're going to do with it after you get more information, I don't know, because I don't think you'd be in a clinician's. I don't think you'd be a therapist. I'm sorry.
Right.
If you didn't want to know about people.
Right.
But you know what? I like football. I don't like hockey, but I know about hockey.
Right.
I mean, that's crazy.
So no. So here's what it is, Jenny. Thank you. That's dead on accurate, because Jenny, it's more than just curiosity. I didn't initiate this. I didn't put so many wheels in motion to make this happen, from marketing to advertising to invitation to time spent. If I was just curious, this is beyond curiosity, right? But that doesn't mean that I'm fully on board to say, hey, I'm cool.
Right.
But it doesn't also mean that I'm rejecting.
Right.
There's almost a spectrum, right? And Alex, you know this because we know this clinically. So many disorders, so many conditions, from addiction to mental health and mental illness, are on spectrums. I'm not full on rejecting. That's why I wanted to have this conversation, but I'm not full on accepting, because that's why I wanted to have this conversation. Nor am I saying that my goal for this conversation, the purpose of this conversation is to get to full-on acceptance, nor is it to get to full-on rejection. It's not one or the other. It exists almost on a spectrum, right, Alex? Right, Jenny? Right, the rest of us?
Yes, sexuality and gender identification all exist on a spectrum.
Yeah.
You get it.
I get it. Thanks. I think I got something. Did I graduate? Do I get a gold star? I don't know. I don't know what I get at as a result of this.
I'll send you your certificate in the mail.
Right. No, just send me money, because if you support me, you'll send me money.
Oh, okay. Okay. Yeah.
Right. But here's the thing, right? So that's the takeaway. Understanding that, why are we having this conversation? It's 7:45. We've been doing this for a little while. And later, some people may watch this and understand, or maybe not. Why did we choose to have this conversation? Why did I choose this topic? Because I don't get it. But I'm trying to get understanding, but that doesn't mean that understanding also means full-on acceptance. It just means a willingness to not fully reject. And while I reject certain parts, just like we do in every other part of our life, right, from addiction to sort of professional, experience, to salary or money or not, I don't fully reject. We got to understand that there's a spectrum, and there's a lot of places to be on this journey and on the spectrum. And there's still not a full-on sort of arrival. We still have room to grow or not grow based on what we do with our next steps. That's what Jenny's saying too. I don't know what you're going to do with this information, Salo, but you invited me to this conversation, and you're willing to have this conversation with me. And do something with this information. As we lost Alex, hopefully she'll come back, right? We'll do something with this. What will you do with it? Do you have to have an answer to what I'll do with it? Because maybe I don't know, Jenny.
No,
Okay.
because again, my mindset is you do you.
Mm-hmm.
I hope that what you do doesn't affect me and mine negatively. I hope it doesn't affect you negatively.
Yeah.
But you have to do what your path is.
Mm-hmm.
I don't have to like it. I don't have to understand it. I don't have to agree with it or support it. I'm not, but to throw your words back at you, I'm not rejecting your point of view. Right.
Alex is texting me saying, what happened? I didn't kick you out. I swear. I will not kick you out because I don't agree with you, right? So please sign back on it. And anybody who's missing this, here's what I'm going to do, Jenny, and here's what I'm going to do for the sake of time, because you've been a trooper. I think that I've, we recognize that there's space for questions and answers and time to marinate, to process and all that. So we welcome questions now from those who have joined us. We welcome questions, those who, whether it's in the chat or unmuting yourself and asking your questions, or turning on your video and asking a question. So we put a face with the question. But let's navigate some questions, if you will. I don't know where the questions will go. Welcome back, Alex. I'm glad you're not fully mad at me all the way, and you decided to join.
Sorry, my internet went out. I don't know what happened.
Yeah, and her internet went out, and she immediately blamed me, asking me what happened. I don't know. I'm not there with you. Why are you blaming me? There's always blame in this. If you don't fully accept me, then you must have did something to then flex on me. No. That doesn't mean I kicked you off. That just means something else happened and I didn't control all the variables, Alex. Case in point. Thank you, Alex, for proving my point.
You're welcome. That's what I live for.
Look, let's take this. Look, we've got a few minutes here. If you guys are willing, if you ladies are willing, and all you individuals are willing, because I'm learning to be more sensitive with my language. I don't know, whatever that means, right? If you individuals are willing to engage in a question and answer, right? Give us some questions. What do you think? What are the questions that you have as we've taken this journey? This is by far not an end to the conversation, but this is almost a pause and an initiation of conversation. Maybe you take this as a video tool to start the conversation, right? Maybe, Jenny, you use this as a conversation starter with your child's father, right? Or not. I don't know.
No.
She said no. Jury's out and back in already. No.
Yeah, exactly.
Sorry. Okay. But maybe you and I continue to have a conversation, right? What are you guys' questions? What are the questions you have for Jenny, for Alex as a provider? Yeah, Shay, I see your hand. Go for it. Take it.
Jenny, I want to ask, how did you do, I don't know how to word this, like research to become more knowledgeable about the whole non-binary thing, or did your child just kind of like give you their knowledge on it, or did you like go and Google it?
Yes.
Yes, Google is the answer.
Google's the answer for everything. No, my child and I did talk about it. And I did have to go Google things because I didn't understand. And my child at the time, they were 14, didn't really have the textbook explanation of things. So I did my own research, but I also listened to my child. We watched a couple shows that had non-binary characters in them. So I just took as much information as I could to figure out what was going on.
Yeah. Great question and great answer, Jenny. I'm going to jump in and say this. Listen, to go to one source, just like you wouldn't do this for school or for your book report, and you wouldn't do this from a therapy standpoint, or even this topic that's so sensitive, you cannot go to just one source to learn. Right? This conversation right here should not be the be all end all for the learning and then the sort of the decision maker for where you stand on this. This is just one piece of a very large puzzle with many pieces. So learning comes from a lot of different places.
Yes.
So Shay, thank you. That's a great question. Learning has to come from more than just your therapist, more than just your parent, and more than just from yourself or from TikTok or social media, to be fair. Well, you need to learn from more than just one place.
Right, because I don't think in a lot of the LGBTQIA plus community, it's not as simple and black and white as 2 + 2 = 4.
Right.
Because every single person has their own truth. And what is non-binary to my child may look different to Alex, to Shay, to anybody. So I think the more you can get and the more you can learn, you'll just get a better understanding. Honestly, to me, that's what I think.
Yeah, I'm going to expose something here, Alex. I'm going to, for the risk of further people and for future maybe numbers or not, I don't know, maybe you hate me as a result of or not, but Alex, you and I have been on this journey and continue on. Alex and Alex has known, she's been on this journey with me. As I've said, I am very gender definitive. I love my penis. And I've said this many times. And yet Alex gets mad at me when I say this, and many people do, as Shay shakes her head, because part of the journey and the navigation and the learning is statements like that. And why is that insensitive or not? As you make a statement like this, and me and Alex have literally have the tennis match of back and forth, that's part of the learning, right? Learning is not just in the wording and the language and the understanding, right? Learning is in the sensitivity, learning is in the receiving, learning is in also the giving and the willing to educate, right, Alex?
Right. And the other piece of that, is understanding the history and the oppression and the privilege that you, fortunately or unfortunately have as a
I'm good looking? Is that what you're saying? I'm sorry, I'm good looking.
As a cisgendered heterosexual male, you have that privilege in our society. Right. And so, understanding that, and that's a hard thing for a lot of people to receive and understand.
Mm-hmm. Yeah. So looking at privilege, issues like privilege when you're talking to a man of color, but it's still being a man, right? Because I say I'm gender definitive, and that's a privilege that I get to say, right? Or not. Because when we talk about this sort of spectrum, when we talk about this sort of social aspect and what privilege even means in and of itself, and understanding how privilege is based on the topic, based on the subject, based on the recipient or the provider, I don't know, the dominant culture, if you will, of certain terms. These are all topics or issues that will influence sort of the learning to be had. And again, this is just one part of the puzzle. So thank you, Shay, for that question. Thank you, Alex, for entertaining that and the ongoing learning that I'm willing to have as I navigate this, right? The jury doesn't always have to be fully out or fully in, right? Like I'm still figuring this thing out, just like Jenny is, just like a lot of us are, right?
Yeah, I think that's totally fair. It's a process.
It totally is. You may never arrive to a certain place, right?
Nope. Sometimes the beauty is in the journey.
Who said the journey had to be beautiful? It's bumpy and scary along the way, right? It depends on what you look at is what was said, right? What parts are you willing to focus on the journey? Here's what I do know as I navigate this journey for me, as somebody who's continuing to willing to learn, like Jenny pointed out, it's not always beautiful and it's not always clean and polished. But let's continue to take the journey. What parts are you willing to focus on? Right? Yeah, good. What other questions we have? We have a few minutes to navigate some questions, or does this kind of put the closure on the conversation? What do you guys think? What questions are there? What questions came up as a result of the conversation, even from my panelists, if you will?
Really have any questions? I really enjoyed having this conversation. I mean, as you know, I enjoy having a healthy discourse about these things, and especially if we don't agree, because I want to know what the other side, is thinking, because it is something that that we have to face every day. Is, there's people that are going to be on the opposite end, and it's easier to come to the table and discuss it when you're willing to have that discourse. So.
Yeah, good point. Good point. Listen, there's a reason I didn't ignore it, just out of ignorance, but I intentionally didn't go to issues like religion, issues like spirituality, issues like that, because this is a clinical platform for this portion of the learning. This is clinical, and I had to stay focused on the clinical, the mental health, and the substance use portion of it, knowing that there's so many other things that influence it, but there's more learning and more conversations to be had, especially with regards to religion and beliefs and spirituality, because those topics, those issues influence things like recovery, right? In 12-step and AA and NA, right? And the Christian worldview or not. So I know that it plays a part, but I can't capture everything. We couldn't capture everything in 1 hour-and-a-half sitting. You can't do this. You can't say that this is it, and this is the definitive sort of deciding factor in what you choose, just like gender and just like sexual orientation, correct?
Yeah, I think that's totally fair. I think it's also fair to say that you couldn't capture any one aspect of humanity in a 90-minute session. So
very true. Very true. So Jenny, what would you have everybody kind of take away with them in your journey, both in participating in this and in your child's journey, or as a part of this puzzle? Like, what would be the one takeaway for you that you would want people to understand?
Honestly, that LGBTQIA plus people are just that. They're people. They're not right. They're not wrong. They're just like everybody else. They deserve our love and our respect. They're just people. Yeah. They're just like us. There's nothing different about anybody in that community. So that's super basic, but that's my biggest thing.
Right. Good.
So
I appreciate that. Thank you, Jenny. Alex, what would you want people to take away from this conversation, this 90 minutes? While it's not the be all end all, there's sort of a takeaway point as a clinician, as a quote unquote subject matter expert, as somebody who continues to grow in this clinical field of addressing not just this population, but many topics. What would be the takeaways that you would want people to have maybe clinically about this?
I think for me, and this was something that I wanted to say earlier, we're required to do continuing education units every year for a reason, because people are dynamic and they're constantly changing. The research is constantly changing. I mean, so for me, for clinicians, I think it's important, if this is something that you're running into or that you're struggling with, educate yourself, do a Google search, find a training, find something to just get that information. And you don't have to like it, you don't have to accept it, but getting the information is the first step. So I also think it's really important to be able to advocate for members of the LGBTQI plus community to speak for themselves, because again, I'm the subject matter expert on this panel, but by no means do I even know any small percentage of what every person that identifies as this community has as an experience for what they, what they're struggling with. So
actually, can I change my
listening to their stories and listening to
No, Jenny, you can't change your answer. You're stuck. No,
I want to completely agree with Alex.
Hey, don't do that. You're just gonna fuel her flames. Don't do that. I would never completely agree with Alex.
No.
Why would you completely agree with her?
Conversations need to be had. Make them uncomfortable, make them comfortable, learn Just keep the conversation going, because that is how anything is going to change about this community. As you brought up, mental health, addiction, anything, race, anything, keep that conversation going.
Yeah.
That's how change will come about.
Exactly. Thank you, Jenny. Thank you, Alex. And here's my piece of that I want people to take as we come to a close of this chapter of Real People, Real Talk. Listen, not just keep conversation going, Jenny, but maybe be willing to initiate conversation. However, conversations need to be initiated. And we know this from many levels, not just from a clinical standpoint of areas of development or developmental stages, but conversation is initiated not just face-to-face. Conversation is not just initiated on TikTok. Conversation is not just initiated electronically, but initiate conversation in some way, shape, or form that engages somebody else in this journey so that we can initiate and then keep the conversation going, Jenny, Alex, right? To keep it going. We have to be willing sometimes in some sort of way to initiate. Why did I start this subject matter? Not because I wanted to be a part of, not because I fully say I'm coming out to say I am this or I am that, but I know that I needed to have the conversation and I needed to lean into the pain of what I kind of educate some of my clinicians on. If you don't get something or something is painful to you, you need to lean into it so that you can then release some of the conversation, some of the pain that comes from it. And I'm willing to initiate that because I don't know that I fully came to a conclusion of something now, but I also know that there's more conversations to be had. So lean into it. Dive into it, initiate, and then keep going the conversations, both clinically, with substances, with parents, with older generations, with younger generations, right? Cassie, thank you for your participation. We need to recognize that we have this. Thank you, Shay, for your questions. Thank you guys for being a part of this panel, right? We need to have conversations. And listen, for me, I had this and I initiated this because I wasn't sure where I was with all of this. And I know that as a result of having Jenny and Alex and some of you guys with us, Carla, that joined us earlier, it helped me to really understand that it's okay that I'm still trying to figure this thing out for myself. And that doesn't mean full-on rejection as I try to figure it out for me, not because I'm trying to figure out my orientation myself, not because I'm trying to figure out my sexuality or my gender. I know what those are. I'm good with those parts, but I'm willing to know that there's more to the conversation as I continue to journey this. And that doesn't mean I full-on reject everything about it, but it doesn't mean that I fully accept it either. And I don't have to, and you don't have to, right? We don't have to. We could be definitive about certain decisions and things we have after we feel that we've educated ourselves enough and learned enough, but I don't know that learning ever fully stops. So maybe you never fully learn enough, and maybe you're never definitive enough.
Right.
That's something to be had and something to be said. As somebody who fully knows I am fully a man of color, fully bald and never get my hair back, fully a man with a penis, and fully a father, and fully so many other things.
Never say never.
I don't think I'm ever going to get hair, Alex. I don't think I'm ever going to get hair. I'm pretty much going to
keep the dream alive.
Laura, nor am I ever going to get younger, right? So I know that too. But thank you, Alex. Thank you, Jenny. Thank you, everybody who participated tonight in this Real People, Real Talk topic. And please don't stop the conversation here. Keep the conversations going. We're going to post this on our social medias, on our YouTube, and keep the conversations and the questions coming for Carla, for Alex, for Jenny, for each other. If you have questions, if you want to know tools or resources, Alex is a great place to go. Send us your questions and I'll funnel them to Alex. If you want to know what it's like for a parent of or in the family, as you continue to have that, bring those questions and conversations to Jenny and to Carla, who had to leave, and for each other. And until we have our next Real People, Real Talk, thank you, everybody, for participating.